My name is Dr. Dennis Goodman. I want to welcome you to our Heart Health Lecture Series, which is presented by the Center for Prevention of Cardiovascular Disease at NYU Langone, Grossman School of Medicine. I'm a clinical professor of medicine and director of integrative medicine at the Leon H. Charney Division of Cardiology. And it is my pleasure to present the series to you with my right hand, which is Anya Coates, and I want to thank Anya for all she does to make this happen. It's a lot of work, and of course, I'm so grateful to the speakers that come on and do this, and very grateful to the audience. We have a lot of regulars, and we have large numbers of people who listen, so we're delighted to put this on. We're all about prevention and health and holistic health, and we've given many lectures over the last 5 years or so. And you can see I just put some of the topics up since 2000, more than 5 years, more like 8 years. We've had over 60 lectures. And here's some of the topics: the microbiome, sleep, diabetes, cholesterol, blood pressure, thyroid, inflammation, oral hygiene, stroke, osteoporosis. And we focus very much on how to prevent these diseases so that you can live into an old age feeling well and healthy. My next slide. So I'm very much about the five-legged stool. It used to be a four-legged stool, and these are the things that I like to focus on in terms of prevention. I always like to say that wellness is not the absence of disease. You can only feel well if you're taking good care of yourself and you focus on nutrition, exercise and flexibility, sleep, stress management. And I think socialization and connection to other people and helping other people is a very important part of being well. And you're going to hear about some of these things tonight from our speakers. Next slide. We have a video library now. We've got over 35 videos with thousands of views, something close to over 90,000 hits at this moment in time. So you can go back and watch a lot of our series. And also tonight will be recorded, so you'll be able to listen to that. Please tell your friends about it, because it's so nice for people to go into the lecture series and hear some of the lectures they've missed or get updated on various topics. Next slide. We're going to have our upcoming talks are going to be on these particular topics, and they're going to be in early next year. An update on aspirin and blood thinners, should you take aspirin, cholesterol, the good, the bad, and the ugly, and all about lipoprotein A, and why sleep is essential to heart health, and we'll let you know the exact dates. We're working on it now. Next slide. So to learn more about our Heart Health Lecture Series, you can register at nyulangone.org/Heart Health Lectures. That's also a link from there. You can link to our video library on YouTube. There's our email, and you can also connect with us on Instagram and Twitter. Just to remind you, we are all part of the Center for Prevention of Cardiovascular Disease at NYU Langone. Don't forget that you can ask a question during the talk. There are a lot of questions that come in before, but if you go to the Q&A box, you can put your questions in there, and I'll be fielding the questions, and I'll try to get to as many of them as possible. It's not always possible because there's so many questions. And one of the nice things about our speakers tonight, they both said that you can email them if you have a question that doesn't get answered. Next slide. So tonight, the topic is dementia in the cardiovascular system. This is a huge topic. We could do a whole day seminar on this. We're going to try to give you the main points in an hour. We are very privileged to have two incredible speakers, Sunnie Kenowsky and Bonnie Marks, both doctors and both absolute experts in the field. They've both got long CVs. I'm just going to mention a few things about both of them, and then they will go on and give their talks, and then we'll take the questions. Dr. Kenowsky is an experienced Alzheimer caregiver and co-director of the Zachary and Elizabeth Fisher Alzheimer's Disease Education and Research Program at the NYU Grossman School of Medicine. She's held this position since 1995. She's a clinical instructor. She is an Alzheimer and related disease care specialist at NYU and a professional research scientist. She's received many acknowledgements and many awards. She was awarded a medal for her meritorious public service by the Department of the Navy as a strong supporter of the United States Naval Service for significant humanitarian service in the research and treatment of Alzheimer's disease. She's a member of the Content Advisory Board and content advisor to the alcinfo.org, a nonprofit website devoted to Alzheimer's since 2001. She's got a large experience with Alzheimer's patients, and really, to be honest, I don't know anybody that knows more about Alzheimer's than she does. And in combination with Bonnie, who's an absolute expert on what are the most important things that you should be doing to prevent Alzheimer's, you really have an incredible duo tonight. Dr. Marks is a senior psychologist at NYU Langone Rusk Rehab. She joined Rusk Rehab as a graduate student, and she earned her doctoral degree in psychology from Fairclough Graduate School in Psychology. She's been working with survivors of brain injury and their families for 21 years to help them develop compensatory strategies to improve cognitive, emotional, and social functioning. Her special interest includes training patients how to change their lifestyle habits to achieve good health and improved quality of life using mindfulness, fitness, and relaxation therapy. And specifically, she's going to be talking about that in relation to cognitive function tonight. She's a supporter of the Special Olympics and Achilles Club and enjoys being a guide for athletes with brain injuries training for the New York City Marathon. So, both of you, thank you so much for joining us tonight. We really appreciate your expertise. We appreciate you being here, and I look forward to your lectures tonight. So we're going to start off with Dr. Kenowsky, and then Dr. Marks will take over, and then we'll take the questions.
And thank you for having us. I think this is a really wonderful topic. It's very interesting, and there's so much new information that is coming out in terms of risk factor and lifestyle changes that I'm pleased to share with everyone today. So I'm going to start by talking about dementia and what it is and the causes of dementia. And then I will move into talking about the most common dementia, which is Alzheimer's disease, and the new treatments that have recently been approved for Alzheimer's disease treatment and mild cognitive impairment. And then I'm going to move into the risk factors for dementia, the risk factors for Alzheimer's disease, and the risk factors for cardiovascular disease. And then I will begin the lifestyle changes. But at that point, after I talk about an initial few, such as diet and visiting your doctors, I'm going to then pass it over to Dr. Marks. So thank you for attending. And it's important to understand the definition of dementia. I think this is a question I get asked about 10 times a day. You know, is dementia Alzheimer's? Is Alzheimer's dementia? And so just to clarify, dementia is a syndrome that can be caused by a number of diseases, which over time destroy nerve cells and damage the brain, typically leading to deterioration in cognitive functioning, which is the ability to process thought. Beyond that, which might be expected due to the usual consequences of normal aging. So dementia is a term that's used to describe a group of symptoms affecting memory, thinking, and social abilities. And by definition, people who have dementia, their symptoms are interfering with their ability to carry out their everyday activities. And dementia isn't a specific disease, but there are many, many, many diseases and dementia-like conditions that are associated, with dementia. So dementia generally involves memory loss, but it's often one of the early symptoms of the condition, but it doesn't have to be. And also having memory loss alone doesn't mean that you have dementia either. Memory loss can have many different causes as well. Alzheimer's disease is the most common cause of dementia in older adults, but there are other causes, and depending on the cause, some of the dementia symptoms might be reversible. For instance, if you look over on the right-hand column, you'll see that many of those problems may be reversible. The ones on the left-hand side are the ones that we're going to concentrate on, because those are the progressive dementias that people are usually referring to when they say that the person has dementia. So as I said, Alzheimer's is the most common type of dementia, and it accounts for 60 to 80% of cases. Vascular dementia, which is also known as post-stroke dementia, and multi-infarct dementia is the second most common and accounts for 20% or more of the total of all dementia cases. Lewy bodies dementia accounts for 5 to 10% and is associated with Parkinson's disease, and frontotemporal lobe is now thought to make up 10 to 15% of cases. And our recent studies suggest that mixed dementia, or what we call multifactorial dementia, is more common than we previously thought. And we found out that now more than 50% of people with dementia who were studied at the Alzheimer's disease research centers in the US, they had evidence of more than one cause of dementia. And when we look at community-based studies, we see that that percentage is even higher. And research studies also show that the likelihood of most people with this type of dementia, combined dementia, it usually affects the oldest old. So if we look at the cause of dementia itself, we see that there's two forms. There's younger onset, which is also known as familiar Alzheimer's, and late onset or sporadic Alzheimer's. Early onset occurs in people in their 30s to the mid-60s, although I have seen people who are even younger in their latter years of their 20s. It has a genetic inheritance, and the three major chromosomal mutations are listed there on your slide. With our enhanced genetic testing and screening now, we can find many more genes that are associated with younger onset Alzheimer's. Late onset, the symptoms begin in the mid-60s and are caused by a combination of genetic, lifestyle, and environmental factors that are still under investigation today. We're finding more and more risk factors and causes of Alzheimer's as the days go on. And we're starting to develop an outlook of personalizing or individualizing our medical treatment for people. And it's going more towards a form of what we call precision medicine, because that allows us to give each person a treatment according to the disease process that they're affected by. There is a specific form of what's called apolipoprotein E, which is a carrier of cholesterol. It shuttles cholesterol around in your body, and that determines the risk for Alzheimer's disease in the sporadic late onset population of people with Alzheimer's. If you have the isoform of E2, that's protective and delays onset. But if you have E4, that will increase your risk. And if you have a double copy, your risk will be increased even further. The brain has billions of neurons, and they're formed with an axon, dendrites, and a nerve cell body. And to stay healthy, the neurons have to communicate with each other. They have to carry out metabolism, and they have to repair themselves. Interestingly, human neurons can live up to 100 years old, so they're not like the other cells in our body, and they need to repair themselves. Alzheimer's, unfortunately, disrupts all three of these critical processes, and it does it by abnormal processing of what we call the amyloid precursor protein, and we end up with what we call beta amyloid plaques. We also have a problem with another protein called tau, which is helping to stabilize the nerve cell and the microtubules that give it structure. And in Alzheimer's, they then clump together and form neurofibrillary tangles. And those occur inside the cell, so they really disrupt the cellular processes a lot. And the result is that we get nerve cell death and nerve cell loss and release of chemical compounds that are used to communicate from one nerve cell to another, and a lot of toxic products that get released then into the environment. And so understanding the underlying molecular and cellular mechanisms is really key for us to discover new therapies, because there are so many different variations of what we call Alzheimer's. So currently, there are a lot of ongoing studies at the cellular and the molecular level, and what they're looking into is the oxidative damage and inflammatory pathways as central mechanisms in Alzheimer's disease pathology, because we're finding that these are common pathways in many of the risk factors like anxiety or depression. Vascular problems occur as well, because we end up with having clogged arteries and other problems that can lead to decreased blood flow and decreased delivery of oxygen and nutrients such as glucose. And those two are needed to produce energy and carry out metabolism. And oxidative damage itself can easily damage the neuron. So those are our new areas that we're currently looking into, as well as the microbiome. It has a big effect, and sleep as well. So in terms of pharmacologic treatment of Alzheimer's disease, we've had the acetylcholinesterase inhibitors and the NMDA blocker Namenda around for, oh gosh, I think it must be at least 30 years now. And those drugs were helpful in the sense that they improved some patients' ability to carry out activities up to a year or so, but they didn't stop or reverse Alzheimer's. And from that point in time, we went through years and years of failed trials where you were hearing about one monoclonal antibody after another that failed and didn't work, one inhibitor after another that wasn't working either. But the good news is that in July of 2023, Leqembi, which is generically called lecanemab, received regular approval from the FDA to treat mild cognitive impairment due to Alzheimer's disease, as well as mild AD. And Leqembi is a monoclonal antibody treatment that targets amyloid. It's given intravenously every 2 weeks. And it does slow or delay the symptoms of Alzheimer's, but there again, we don't have a cure, and it doesn't reverse Alzheimer's. So Leqembi has showed meaningful slowing of cognitive and functional decline beginning at 6 months and continuing through 18 weeks. And patients that have been on Leqembi took 5.3 months longer to reach the same level of cognitive and functional decline as subjects receiving a sugar pill type of a treatment. So unfortunately, there are quite a few potential reactions or side effects that we're seeing with Leqembi. One is infusion-related reactions, which is not uncommon, and it's seen in up to 26% of subjects that are taking Leqembi and 7% of those that are taking the placebo. And those reactions are flu and fever-like symptoms, nausea, vomiting, hypertension. Sometimes the blood pressure will go the opposite direction and we'll have hypotension at the same time, because it'll go up and down. And we'll also see oxygen desaturation. But in most cases, it's easily treatable. And in most cases, the reactions were mild. The most common side effects of Leqembi are the infusion-related reactions, swelling in the areas of the brain with or without small spots of bleeding in or on the surface of the brain. And that's what we call the amyloid-related imaging abnormality, or ARIA for short, because that's quite a mouthful. And headache, those are the most common. ARIA is concerning, and it's most commonly seen as just that swelling, and it will usually resolve over time, usually within the first 14 weeks. And it usually occurs early in the treatment, and it's usually symptomatic. It's asymptomatic rather. So usually there's no symptoms, but rarely you can have serious life-threatening events, which include seizures and other reactions. Some of the symptoms of the temporary swelling are headache, confusion, visual changes, dizziness, nausea, difficulty walking, and seizures. And you can have focal neurologic deficits that may occur as well. But as I said, for the most part, you don't usually see symptoms. It's just something that we see on the MRI. There is a warning with Leqembi that's directed towards those people that have 2 copies of that apolipoprotein E, E4 isoform, and those people are at a very much increased risk of symptomatic, severe, and serious radiographic ARIA compared to people who maybe only have 1 copy of the E4 isoform, and to people who are non-carriers or have E2 or E3. So testing for ApoE4E, apolipoprotein E, epsilon 4 isoform status should be performed prior to initiation of treatment. You can still get treated if you don't have it, but you should know the risks that you're facing before you do. So it's important to talk to your doctor. Treatment of Alzheimer's disease, as I mentioned, is also non-pharmacologic or eco-biopsychosocial. And this is important because these drugs are still not giving us a cure. It's prolonging people's lives. They're functioning at a little higher level, but they're going to be living for longer. So that makes care and management of care and caregiver training extremely important. And you can see the number of programs that are very successful that are here on this slide. We also have a lot of therapies, many of these that Bonnie's going to go into, that are have also been found to be very effective in helping with cognition, quality of life, and sometimes with activities of daily living. Additionally, in October, we now have the ability to do deep brain stimulation without surgery, and that's really an incredible advance, and they do feel that it's going to help restore memory. I don't know, we'll see. I personally do favor transcranial direct current stimulation. I've used certain medical devices with patients of mine, and I've used it myself. And I do think that it can be helpful in certain treatment situations. And also the transcranial magnetic stimulation is showing positive results, but in all these things, the results vary. And so we need more complete, diverse, and larger population studies. And the same is true when it comes to the clinical trial results regarding supplements and vitamins. There is a lot of literature out there. None of it has conclusively shown without a question or doubt that it will prevent or it will delay the progression of Alzheimer's. That being said, there are studies which do show that ApoE4 non-carriers after consuming medium chain triglyceride containing food, they did see an improvement in their cognition. An improvement in cognitive function was seen after subjects took a probiotic and selenium supplement for 12 weeks. There was also a trial with 7 essential amino acids that you see here on the slide that showed benefits where there was improved cognition and psychosocial functioning. There have been new studies more recently where they're administrating combined metabolic precursors consisting of NAD and glutathione precursors, and those are resulting in improved cognitive functions in patients with Alzheimer's, but these are all small studies. It's not true across the board. They haven't been replicated, and they're not reliable. Older adults also, there was a Cosmos study that I'm sure you all read about. There was a study where older adults who were normal took a multivitamin each day for 3 years and found at the end of 1 year that there was a mild improvement in their memory versus those people who were taking a sugar pill. But there again, people, you know, we're looking for an answer. And so we want this to be a cure for, you know, our cognitive aging due to age, but it's just not there yet. The science is just not there. Some of the new cardiovascular risk factors since the last time I was addressing this audience are poor dental health, and probably the microbiome, dysbiosis, I think, and also the impact of sleep. I think those are probably the things that have been most in the news by in the current public view in the news in that sense. So the rest of these risk factors, I'm sure you're all aware of since you're in Dr. Goodman's good care, and we'll address a lot of these risk factors as we go on, because they're also the similar risk factors for dementia. Here we see a slide, and this has the category of risk factors for dementia, and you can see that there's a lot of categories. And for each category, there's a lot of other risk factors. So I like to look at it in terms of what's non-modifiable and what's modifiable. And if we look at the non-modifiable risk factors, we see that age, older age is a risk. Being African American more than being Caucasian or Asian, having a Hispanic ethnicity, or a family history of a first-degree relative having Alzheimer's, or any of the genetic influences on the right that we've discussed, all can be risk factors that we can't do too much about. You can modify some of those factors if you're trying to change an embryo, but in an adult, we're still not quite there yet that we can do a great job of modifying everything. Here you can see all of the risk factors, and there's quite a few of them as we see. These are shared risk factors between cardiovascular disease and dementia. We've already mentioned most of them. And I would just like to bring your attention that risk factors can also be protective factors. It depends on which side you're on. If you have low education, it's a risk. If you have high education level, then it's actually protective and gives resilience to your brain and enhances your cognitive reserve. So that sets up a lot of implications for preventing Alzheimer's disease and also slowing its progression, because all of these things that are listed on this slide are basically modifiable risk factors that we can change by what we do ourselves and the choices we make. Modifying the 12 risk factors below, also, it's very exciting, have been shown that they actually might prevent or delay up to 40% of dementias. This was found in the 2020 report of the Lancet Commission. So remember to visit your physician, have all of your levels checked for everything, and make sure that you follow your doctor's advice about remedying any problems. Treat current medical problems, especially oral diseases like gingivitis and tooth loss that can lead to Alzheimer's. Avoid drugs that might cause cognitive impairment, and try to employ the MIND diet, which is a combination of the Mediterranean DASH diets. It's developed at Rush Medical Center, and researchers found that people who adhered to the diet lowered their risk of Alzheimer's by 54%, and those who only partially followed it lowered their risk by 35%. So this is a really good bet. The diet has also been found to lower the risk of coronary artery disease, hypertension, myocardial infarction, and cerebrovascular accidents as well. You can see that it's mostly green leafy vegetables, other vegetables, berries, beans, whole grains, and nuts. A little bit of poultry and fish, and using olive oil instead of other oils or substances for cooking. And a glass of wine, preferably red, but no more than one a day, and avoidance of all of these foods, all the things that we love, like pastries and sweets, fried or fast food, processed food, saturated fats, trans fats, hydrogenated oils. And if you are going to eat animal product, things like butter and margarine or cheese, make sure that it's grass fed, because that'll be the most healthy. And before I hand it over to Dr. Bonnie Marks, who's going to discuss the other recommended lifestyle changes, I just want to mention that if you're interested in participating in Alzheimer's disease research, please call the number on your slide. And I want to give special thanks to Harris Tarosian for his great assistance in preparing these slides. Thanks to NIA and NIH for use of some of their PowerPoint slides, and for funding support from the Louis J. and June E. K. Foundation and the Fisher Center for Alzheimer's Research Foundation. And if you have any questions, please feel free to email me at the number that you see on your screen. And thank you.
Hi, Dr. Kenowsky, just before we have Bonnie, have you still got your slides up?
No, I just...
Okay, we'll put it up at the end. There wasn't really enough time for people to take that number down. So
it's back up.
I just want to give people, 30 seconds, because that's really important. It's your second or third last slide where you said if people are interested.
Okay, let me go.
We can come back to you.
Okay, here's the other slide.
Yeah. Yeah, so just so that people can see, maybe they can take a screenshot. As I've said, this is being recorded. They'll be able to look at it, but there's the number. I think there are a lot of people that are interested, maybe being in touch, or they know somebody and they'd like to get involved in some research. So they're the numbers. Okay, thank you. Thank you. I think
it would be very helpful. We're always looking for participants, and it's wonderful when people participate in research because they help us find answers to all these questions.
Exactly. That was fantastic. Thank you so much. And I'm looking forward to hearing Bonnie, who's going to amplify some of the things that you've said.
Hello. Thank you for signing in tonight and joining us. I'd like to share information with you on evidence-based approaches to help you initiate and sustain good healthy behavior. So this part will be more about the psychological side of managing the cardiovascular and cognitive wellness. And so we'll talk about lifestyle changes that some are easy, some are more difficult, but how to stay motivated also to maintain these healthy habits, because it's easy to start, right? But we know that from the research, about 3 months later, sometimes people kind of lose interest. So the question is, how do you sustain it? And what can you do now? Like right now, people ask, is it too late to start? No, it's never too late to start. So we'll go through some immediate changes you can make that are quick and easy. And then we'll talk a little bit about brain health, cognitive health. How do you preserve cognition, and some of the new findings that the research has shown lately, and that's pretty exciting. Okay. So when it comes to making changes for healthy behavior, to change behavior to make healthy changes, it's pretty tough. I mean, a lot of us say, you know, what, give up my ice cream? I don't want to hear that. Or no, I don't see myself at the gym 3 times a week. No way. So, you know, sometimes it's kind of hard to give up certain things and to change and modify behavior. It's the hardest thing for humans to do. Next. So, you know, the old adage, what's good for the heart is good for the brain. It's true that we know that the factors that can increase heart disease, including blood pressure, smoking, and so on, increase the risk of dementia. So that's why we address both tonight. Next. So the question is, what can you do now to experience wellness? And it's, as I said before, it's never too late to start. Okay, so, you know, these are things you can do in the next 24 hours. Quick and easy, very light. Jazz up your drinking water with fruit. Take a 10-minute brisk walk. Share a joke. Humor is good. Become a volunteer. Altruism is a good thing. Makes you feel good and contribute. Also try yoga, Tai Chi, mindfulness, meditation to bring on relaxation, to calm anxiety, to reduce depression, and the studies show that. And you know, even if you're only able to do light activities, that's okay too. Yard work, gardening, shopping, and so on, and daily activities such as cleaning. Thank you. So one thing you can do and work on, and that the research is very solid behind this, is to develop stress resilience, to manage your stress. So on one side, you see in red, you see the high blood pressure, fatigue, muscle tension, depression, anxiety, irritability. Does that sound familiar? But there's something you can do about that, and you can practice a relaxation response, which was created by a cardiologist, Herbert Benson, at the Benson Henry Institute, Mind Body Institute in Boston. And so you can do different things, visualize positive images, practice breathing techniques, do progressive relaxation such as yoga nidra, and then meditation, and also mindfulness. Next. So the studies show that mindfulness actually works, and it's very powerful. What is mindfulness? I know there's a lot written about mindfulness these days, and a lot of people ask, really, what is it? It's staying present in the moment. It's being present and aware of the present moment, what you're looking at, what you're experiencing, the conversation, whatever it is that you're mindful of. Mindful eating, in fact, to be very aware and focus on how good it really tastes. And so mindful eating has become very popular too. And also to reduce distraction, and mindfulness helps you focus more. Athletes use mindfulness training to avoid distraction, to reduce distraction. And so it's also staying present in the moment, but in addition to that, letting go of the judgment. Like, I can't do this. I don't think I can meditate. I've never done this before. So letting go of the judgment and just staying in the moment. And this is a quick one, to focus on sensations in your body. Breathe into your nose, breathe out slowly through your mouth, and then you carry on with the task. And you do that 2 or 3 times, and that will bring you back into a more focused state of mind. Thinking frame of mind, and you can easily refocus that way. Next. Here's a longer version of mindfulness. Again, even if you do it for 5 minutes or 10 minutes, it will stay with you throughout the day. It will impact how you perform the rest of the day. It will reduce your stress. So here are 5 steps. I won't go through each step, but even if you do it 10 minutes, 20 minutes, or build up to 40 minutes, that's great. So just start with 10 minutes a day. Or if you don't have 10 minutes a day, do it for 5 minutes. It will make a difference. Manoj Bhasin is at the Harvard Medical School and the Massachusetts General, and he has done studies with the Benson Henry Institute Mind Body Institute, and has proven that actually meditation can reduce inflammation in the body and reduce certain diseases to reduce the effects of certain diseases, and may even delay the onset of certain diseases. So I just wanted to add his name because he's a brilliant scientist in Massachusetts General, and they actually have done these studies of how to blunt down inflammation. Thank you. So how do you recognize stress? We all have it. It can be behavioral, difficulty sleeping. There's an epidemic in this country of insomnia, lack of focus. I'm just grabbing a few. Headaches, feeling ill, feeling lethargic, reduced appetite, and then psychological, negative self-talk, self-deprecation, like, oh, there I go again, or that was a failure. This is the kind of self-talk that can really increase your stress and anxiety. Self-doubt, intrusive thoughts, negative thoughts, and inability to concentrate. Next. Well, what can you do about it is you can make some goals for yourself, set some goals, meditation, 5 days, 5 days, that's a silent retreat, 5 minutes, and, or, 10 minutes of exercise, or walking, going around the block, taking a brisk walk for 10 minutes. So you can set goals, and these are the stages people often go through. At first they say, I'm not going to do that, forget about it. Then they say, I can't do that. And then a switch, when you visit your cardiologist, all of a sudden you say, I want to do that. And how do I do it? And well, I'll try to do it. I can, and I will. And yes, I did it. It's time to celebrate. So these are the stages. It's hard to stay motivated, as I said before. Next. And then there's this thing called procrastination, right? So you say, okay, I don't really feel like doing this. I don't feel like running. I don't feel like going to the gym. And the main point here, takeaway point is, even if you don't feel like it, one, you can try to imagine that you feel like it, or you can just coexist with that feeling and do it anyway. So just note the feeling and do it anyway. So you can coexist with that feeling of not really wanting to do it. Another technique is strategy is to focus on the process, not the outcome. So if you focus on the outcome, be it positive or negative, you'll perpetuate your fear of failing to achieve it. So if you say, for example, if I'm doing a marathon, I need to focus not on finishing the marathon. I need to focus on what are the steps that I need to take to do the marathon, or to even train for the marathon. So it could be just a series of steps. That's the process. The outcome is, I want to exercise more, but you need steps to fill in the gaps and to have a plan about how you plan on doing this. And it's more than likely it will be achievable then. Next. So examples of inflammation. So when your body has inflammation, the body is in constant state of high alert, very stressful. And there are, like, for example, inflammation in brain, in the spinal cord can lead to Alzheimer's, MS, Parkinson's. Inflammation affects the blood vessels, hardening of the arteries, and then inflammation can affect your gut, your digestive system, and also your immune system. So, and develop into an autoimmune disorder. So inflammation is really key. And many of the studies that Manoj Bhasin mentioned earlier has worked on is how does meditation, how does relaxation response developed by Herbert Benson as a cardiologist, how do those things affect inflammation? How do they reduce? Next. I just wanted to mention quickly, I know Sunnie mentioned diet, that foods that fight inflammation. So these are the foods that fight inflammation in your body. One key takeaway is to avoid processed foods. That's hard to do these days. Now, just to quickly mention gum disease, I know it was on the list of factors that Sunnie presented, but gum disease can be a gateway to infection. And in fact, one study showed that periodontal bacteria found in fatty debris that clogs the artery, is far from the mouth, but it was found in the artery. So just a caution there, see your dentist regularly. And this guy needs one. So just a message about positive outlook and optimism. So the power of optimism is not just feeling great and a super sunny disposition, but it's also applying that mindset to make a positive change. Optimism is more goal oriented. In other words, make a plan, create the goal, make a plan, create the steps. So it means in the study that they did at the School of Public Health, the right approach plus the right action leads to solving problems and improving the situation. So the results will be more positive. Next, okay. Slices of joy. So a lot of people say, well, I don't feel well. How can I be joyful? How can I possibly be happy? The idea is to find slices of joy. So if you see a beautiful sunset, take a few moments and really take it in. Take a photo of it. Really enjoy it. If you're having a great meal, just really relax, take a deep breath, and really enjoy your food, chewing your food, being aware of it. So it's really being aware in the moment. And that's what we mean by slices. Okay, let's get physical. Little Olivia Newton-John here. So we know that from the studies that cardio exercise improves early cognitive decline. And we know that vigorous cardio program the subjects scored higher on cognitive tests than those who did just simply stretching. Not that stretching is a bad thing, stretching's good, but if you can add cardio to it, great. Okay, next. So this is just a slide, and I know you'll have the slides available to you, at least from my end, and 2.5 aerobic exercise of hours weekly. Protect the heart and bones. You got to protect those bones. Next. Okay, next, please. That's more physical exercise. I just wanted to add something about hearing loss. It's very important. A lot of you organizations are doing studies on hearing loss because there's a link. They have found a link. Johns Hopkins, for example, is one of the schools. Next. Okay, brain tips. Avoid multitasking, work in blocks of time, remove distractions. Take a quick run. These are all tips that are scientifically based, evidence-based. Next. Cognitive, stay engaged, keep learning, lifelong learning. Take a course in chess, take a course in, in cooking, Japanese food. Activities like meditation and yoga also enhance brain function through stress reduction pathways. Next. Okay, sleep hygiene, as Sunnie mentioned, that's critical, absolutely critical. 7 to 9 hours a night. Next. Now, staying connected is so important. Harvard has a longitudinal study, 75-year study, and the most important thing near the end of life or later life is to have connection, not to be isolated, to have at least one person in your life you can connect to, or a community that you can connect to. Also, nature is very important. Watching birds, being in the woods. And these are studies through NIH that prove that several healthy lifestyle changes can make a big difference. Not just one, but several. Next. Okay, I just want to mention a study that was done in Finland, and it's still ongoing. And these are all the factors which Sunnie has already touched on. Next. And last but not least, my little boy, this is my dog, Emmett, and he does pet therapy in hospitals and also in schools. And they find that pet therapy is really important. That can make a big difference in the psychological well-being. Thank you.
Okay. Thank you to both of you, Dr. Kenowsky and Dr. Marks. I know Bonnie well, she's a colleague, and really what both of you did was absolutely fabulous. And in fact, it's so obvious that all these things we talk about are not just good for the brain. They're good for the cardiovascular system. They're good for the musculoskeletal system. They're good for cognitive function in general. So I think that it's so important that if people take these tips on board, I've got a lot of people who've asked me for copies of this talk. I'm sure that'll be fine to send some of these slides out, and we'll send them to you. The talk's going to be recorded, as I said, and you'll be able to watch it on YouTube. But both of you have given so many incredible suggestions. And to be honest with you, as a cardiologist, the people that I see, the octogenarians in 80s, 90s, and even 70s that are healthy and well, they are following the advice that both of you are given tonight. And one of the most important things is that they are socialized and they have people they care about and they volunteer and they keep connected and they do the crossword and they read. And so all the things that, and of course they keep physical and they exercise. So it's so important. If you can take on board even some of the things you heard tonight, I can guarantee you that it can only help you. So we're going to go a lot of questions. We don't have a lot of time. That's the only problem. So let's try to keep the answers short. And then I'll take some of the questions that I got during the talk, and we'll try to just get to most of them. So how do you determine the best course of care for Alzheimer's? Are certain vitamins and supplements or foods recommended? I don't think we need to answer that because Dr. Kenowsky, you mentioned that, and we don't have any scientific objective evidence that proves that any of these supplements are going to prevent you from having Alzheimer's. But I will tell you, I believe that people who take some supplements and they worry about their health, they eat more healthy, and sometimes it's very hard to tell the difference between when you're doing these studies to separate it from the other healthy things that they're doing in trying to decide whether a supplement's working or not. I don't know if you wanted to comment on that. I think you're muted.
I just wanted to say that the best, determining the best course for care is individualizing it. And we've developed an entire science of management of care and how to come to that best course. So whoever asked this question, if you could please email me, I would be happy to respond. And I'm also happy to respond to the vitamins and supplement questions because they're very individualized. And that's in large part why we don't have large studies, because they work for some people, but not for others. Because as I mentioned, Alzheimer's is very diverse. And also, I just wanted to comment, Bonnie, when you were talking about the fact that the organism from the mouth and gingivitis is located in the plaques in the arteries. They're also located next to the plaques and tangles in people who have Alzheimer's in their brains. So oral care is extremely important, and I can't not emphasize enough that it's all of these things put together that are important. And the more little steps, as Bonnie was saying, that you can do to help with your life, the better. And organic is very important to answer the question on the right, because pesticides have been shown to be associated with quite a few of the dementias. So, it causes a lot of problems for the brain.
Okay. I just want to say one thing. There are one or two supplements that I do think you should think about. Magnesium, I'm a big fan of it. I saw an article in the European Journal of Nutrition that showed that people that were taking more than 550 milligrams of magnesium a day had improved cognitive function. And I know these are small studies. I like magnesium, I like fish oils, I like vitamin D. I think those are supplements that you should really be thinking about. But again, you should speak to your doctor and make sure that you know what your levels are and all these things. Exactly.
Need to be tested. You need to be
vitamin. Exactly. That's why.
Deficient.
Exactly. Next slide. Are there available tests for Alzheimer's disease? Briefly,
Yes. Yes, there are. We've recently had the development of a blood test for Alzheimer's. So yes, you can also do an MRI. You can do scans that visualize the plaques and the tangles that we were talking about, and you can actually measure brain structures that help to differentiate which dementia you're facing. And we have biomarkers, so you can do lumbar puncture, blood draws that can measure these biomarkers. So yes.
And you can look at the hippocampus, right, and things like that on
Yes.
the MRI. That how can a person or a family know when a person is beginning to suffer with Alzheimer's? And it's what you alluded to originally, Sunnie. Just because you lose your memory is going a little bit doesn't mean you've got Alzheimer's. So where should people start off to try to find out whether they are developing Alzheimer's? And clearly then they want to be very focused on prevention.
Well, I think, the clinical prodromal stage of Alzheimer's may last up to 25 years or longer. So it starts with people developing subjective cognitive decline and then mild cognitive impairment, and then they develop, the eventual dementia of Alzheimer's. So the time when you can really help yourself is in the beginning. So in my opinion, if you're having any symptoms that are concerning to you, it's time to go and get those symptoms checked out, because maybe a lot of the symptoms are due to stress, anxiety, depression, these other risk factors that you may be able to modify, and then you may delay the progression of you actually, developing Alzheimer's. So I think in the very beginning, if you are having a concern about your memory or your cognitive functioning, it is time to pay attention to that. But the time where you can tell, does a person have dementia? And you can't tell that really by looking at them. It's when they are no longer able to carry out normal activities of daily living. For instance, they can no longer balance their bank account. They can no longer pay their bills online, and you'll see that, they'll start getting bills for shutting off of utilities and things like that.
Do you remember offhand some of the medications that can increase your risk of Alzheimer's? Somebody asked me that question, and I think if we can get the slides to them, they'll have that answer. But that was one of the questions.
There's a lot of drugs. So anything that's anticholinergic. So you're talking about things like Atrovent. If you have if you have asthma, you're talking about ipratropium bromide, and what you would want to take instead of that would be albuterol. Yeah. You're looking at whatever anticholinergic medication you're taking, things like Benadryl, not good for the brain. So there's many anticholinergics, and we don't have time to go over them all. There's quite a few on the slide. And if you like, you can email me, and there is a link to the NIH website where they're now listing a lot of those drugs.
And a lot of the people take stuff to help them sleep, Ambien, et cetera, and that
very
can definitely cover.
Yep, very bad for the brain, very bad for your memory. A lot of those drugs can, actually get extruded out of the brain, but there's 6 months period of time where the brain, you might get some improvement, but oftentimes, the damage from the drug can be permanent, if you're taking something that's really harmful for your brain.
So the question about herpes simplex, Alzheimer's.
Yes, there is evidence in that herpes viruses have been shown associated with the pathognomonic lesions of Alzheimer's in the brain. There have been trials that have been ongoing for the last couple of years that are testing Valtrex, which is an anti-herpes medication.
Okay, next slide.
But you can't really eradicate herpes. It's because the drug doesn't kill it. So it continues to stay in your system, just like COVID does. And COVID also is another cause, a viral cause of dementia now.
So we're going to skip over this, what to do about aggression, because I think Bonnie handled that so well. Any link between insulin resistance, prediabetes, and neurocognitive disorders, which is, I think the link's going to be inflammation.
Well, there's actually a link to
and
insulin resistance as well. One of the first lesions in the brain is an inability to metabolize glucose, which is why the ketogenic diets have been helpful and the medium chain triglyceride diets have been helpful for people as energy sources. So yes, there is a link, and we are testing insulin types of drugs. They're doing a nasal spray and some other medications in clinical trials.
So I'll take this one quickly about statins. There have been reports, there's isolated reports about people who felt that the statins affected their memory. In big studies, it's never been proven. I would refer people to something called the Ebbinghaus study, which was part of the Fourier study, where they looked at lowering cholesterol with a PCSK9 inhibitor called evolocumab. They lowered cholesterol down to an average of 30, that low, and they did cognitive testing, cognitive function testing on these patients. They couldn't show that there was any increased or dysfunction in the patients who had these very low cholesterol. So I wanted to point that out. I don't think that is something that we have to concern ourselves with. They're isolated cases, but it's not in any way scientifically proven or thought to be a real problem. How does tachycardia affect those already experiencing dementia? We know that if you've got cardiovascular disease, that's an increased risk for dementia. One of the dementias is related to atherosclerosis, vascular dementia. So a patient could have a tachycardia, which is a fast heart rate because they have underlying cardiovascular problems. The other thing is that patients with dementia tend to have a high heart rate. So you can actually have a tachycardia related to the dementia. And maybe it's got something to do with the fact that they're not exercising, you're not working on your parasympathetic nervous system. And it's very important to focus on what Bonnie said. You want to do these relaxation techniques that help to increase vagal tone and help to lower heart rate, lower blood pressure, and generally make you healthier and fitter. I just want to acknowledge my friend, Dr. He's not a doctor, but he sounds like it very often. Stephen Ho always sends in about 10 questions. I'm going to recommend, Stephen, you send your questions in before so that we can get to some of them. I know you asked about people with hearing loss and preventing dementia. Does stimulation in other sensories make up for the hearing loss? Hearing loss is an important thing. And so the question is, if there is hearing loss, can you help to, offset this by doing things with the other senses? And I'm sure it's got to do with lifestyle changes. So maybe, Sunnie, you could just mention that.
It does help, but the most important thing is trying to restore the actual hearing, because you're using that whole part of your brain with hearing. So I would really encourage people, there are lots and lots of new hearing aids out there that are very user-friendly. I've had people who are deaf that have had surgeries that it's, very restorative. If you get to a good doctor, a good audiologist, they will actually find a solution for, in my experience, 99% of the people. If you absolutely can't find a solution, then yes, or while you're working on those other solutions, yes, it is a good idea to use your other senses and do cognitive stimulation and other things to help yourself, work on balance and different other things that are important. But hearing is very, very important, as is vision. So, it's good to get glasses. I don't like them, but I wear them. And it definitely helped my cognition. And the same with hearing. So please try to get fitted for a hearing aid.
Thank you. I just wanted to ask you this quickly because there's a lot of questions, people saying they've got a parent or both parents with dementia. How strong is the genetic component? You mentioned ApoE34. Do you tell people to test it because in fact it'll increase their anxiety? Or how do you approach people who are coming to you and saying, I've got a family history, and obviously it's so important to do lifestyle changes that Bonnie spoke about, but do you ever recommend doing these tests like the ApoE34 as a way to help people know what their risk is?
You know, that's a double-edged sword. I
Yeah.
think that regardless, people need to understand that stress, anxiety, depression, all of those things are serious risk factors that need to be managed. And apolipoprotein E, the isoforms for those are population risk factors. So you can have actually cases of where a person does have you know, two E4s, and so they're at the greatest risk for sporadic onset, and they might not actually develop symptoms. You know, we know that it's a problem, and there's also a lot of variety within individuals. About 15% of people that have Alzheimer's have the, you know, the homozygote condition. And as we said, like with Leqembi, we're finding that they're having, you know, more serious reactions. So it can apply to the individual, and it can also, you know, be more of a population marker. So I personally think that it's important to have a discussion with the patient and come to an understanding, because regardless of whether you figure out what your ApoE4 is or not, you know, you have a first degree relative with Alzheimer's. For instance, if your mother has dementia of the Alzheimer's type, then you have a threefold increased risk of having, you know, that same Alzheimer's dementia. So the risk is there. And as Bonnie said, sometimes we don't want to hear it or know about it. But in any case, whether you want to face it, you don't want to face it, you want to know, you don't want to know, the important thing is to follow what Bonnie was saying and decrease your stress, agitation. Don't start with negative talking in your head. You know, oh my God, my ApoE4 is, I've got 2 copies, and you know, now I'm going to just have dementia and there's nothing I can do about it.
Well, yeah, that's why I think it's so important.
Very bad.
Sorry to interrupt you, that we don't want to do tests that are going to increase anxiety and depression. You're going to do tests only if it's going to change management or change the way you do things. And I think that if you take on board what you've heard tonight, you don't need to do this testing, because you're actually going to land up not being to be anything that you can do about it except these important lifestyle changes. And I think that there's some people who really want to know, but my advice is stay away from things that are going to make you more stressed, and try to do all the things that Bonnie and Dr. Kenowsky spoke about. You were both fantastic. I think I'm going to bring you back. I've got a whole list of questions. Bonnie, I've got your email here. I want to just give it to everybody, bonnie.marks@nyulangone.org. So if you have a question for Bonnie, and then Dr. Kenowsky, how can people get hold of you? I know you mentioned the phone number there for research. Do you have an email?
Yes, sunnie.kenowsky@nyulangone.org.
Okay. Thank you both very, very much. I thought that was really one of our best, and I've done many of these. I think this was one of our best programs. I'm very grateful to both of you. I'm grateful to our audience, and I look forward to seeing all of you at our next program. And Anya, thank you very much. Happy holidays to everybody. Be well, be safe, and don't forget to try to eat healthy, very important, and make sure you're exercising, and think about stress management and sleeping properly. All the best and take care. We'll see you after the holidays.
Thank you for having us. Happy
It was a
holidays.
pleasure.
Thank you.
Bye.
Thank you, everyone.